correspondent Nicola has been looking into the issue and joins us now from London. And Nicola, I was thinking about this just the other day. I'm a bit overdue for going to the dentist, and I wasn't even sure if I could make an appointment. So what is the situation with seeing a dentist now?
Well, Rachel, it really depends on where you live. If you're in Germany, you can get to see a dentist. If you're in France or here in the UK, you can't unless there's a real emergency. The only treatment you will get is a tooth extraction, or if you're in agony, you can get painkillers or antibiotics if you have an abscess. And this, of course, is because of the danger of spreading the virus because of the aerosol, because of the surgical techniques that dentists use, the water's being spread, the droplets and everything like that. As you said, it's going to be very, very difficult to ensure that people can be safe. And there certainly was one incident of transmission of COVID-19 from an asymptomatic patient to a dentist in Germany. And that's why it's worrying. Now, the medical journal The Lancet published an article from dentists saying that really we need to have better testing for dentists and potentially testing for patients coming in. They'd quite like to have the ability to do some of those swab tests for patients coming in. But there's also fear that if people aren't getting to the dentist, there can be much more serious complications, which could lead to people ending up in accident and emergency departments and even needing intensive care because of respiratory or even heart problems caused by poor dental hygiene and problems. Now, I have been speaking to one dentist here in the UK, Dr. Hap Gill. He's a very innovative dentist, and he has taken on board a lot of these concerns and has made the most amazing changes to the way his practice will operate in future, whether it's changing a protocol for patients. They have to take their temperature before they come into the surgery. The waiting room itself is going to be completely cleared of everything, so there are fewer surfaces for the virus to linger on. So that's no more old magazines that you see in dental waiting rooms. And then he's going to ask patients not only to wash their hands for 30 seconds, but also to rinse their mouth out with either hydrogen peroxide or an iodine mouthwash, both of which can potentially kill any virus. And he feels that, plus an air filtration system that he's put in his surgery, he's invested in, could really help. But he's not able to do any of this or to offer any more than video consultations until the chief dental officer does give the go-ahead and lifts the lockdown and restrictions here in the UK.
Right. So in the meantime, how are people coping?
Some of the stories on social media, Rachel, are amazing. I actually saw that one man had spent 2 hours pulling out one of his own teeth with pliers, a lady using blue tack to replace a filling that had fallen out until she could actually go and buy one from a pharmacy. And I've been speaking to one patient this morning, and in fact it was she who decided us to investigate this today, because she rang me in tears, actually. She was having very complex surgical reconstruction of her front teeth, and she had temporary crowns and a bridge in place. Then the lockdown happened and she couldn't have permanent ones put in instead. These have now broken, so she's left with stumps and apparently a hole in her gum going up to the root of her mouth, the tooth itself. She feels so unhappy and so depressed by how this is looking that she doesn't want to open her mouth. She's in agony. She's having to take painkillers. She's had abscesses, so she's on antibiotics. She doesn't want to speak to her children or her husband because she's so embarrassed by how she looks. She can't eat because she hasn't got the right teeth. And yet she's supposed to be going back to work next week, and she sells cars, so she should be actually speaking to customers. And she did say that the idea of having to wear a face mask for her is a benefit. But she's terrified that if she doesn't look properly, she won't go to work and she might lose her job. So it's worrying. I mean, we do sort of sometimes say, oh, it's really good, we don't have to go and see the dentist. But for people like her, it's quite tragic.
Yeah, some of those stories sound absolutely horrifying. I can't even imagine the pain that some of these people must be going through, pulling out your own tooth with a pair of pliers. What advice is there then for people who need to see a dentist, but they can't?
Well, you can have this emergency treatment, and certainly here in the UK, there's pop-ups, and in other countries, similar advice is being given that you can have a tooth taken out if it's causing that much pain, but you won't get it filled until these new systems are in place. I mean, one of the reasons given for the big closure of dental surgeries is because of the lack of PPE. And so until dentists were able to make sure they had the proper masks, they couldn't treat patients. So really, it's going to be when those are back in place, when perhaps things like Dr. Gill's air filtration systems are back in place. Until then, the main advice to people is good oral hygiene, and to clean your teeth and to floss. Basically, look after your teeth so that you don't need to go and see the dentist, because we don't know when you're actually going to get the general dental treatment that you might want for quite a few months. Dr. Gill says probably not till autumn will he be operating as normal.
Yeah, all right. Good dental hygiene, important anytime. Nicola Hill, thank you.